This is Dr. Ali. Kindly like, share and subscribe to our channel, The Growing Dentist, for more upcoming videos. The topic that will be discussed in this video is about dental implants. What are dental implants? Dental implant is a root replica, or a root form. This implant is a titanium fixture, which means the biocompatible material that is being used in it is titanium. This titanium fixture is inserted in the jaw to act like a tooth root. It anchors a restoration, such as single crown, bridge, or denture. The final restoration looks, feels and functions like a natural tooth. Let's look into the steps for the placement of implant and treatment duration in the oral cavity. Initially, the fixture is placed in the alveolar bone and covered with the gingiva for healing as shown in the first figure. Healing is basically called as the osseointegration step, in which bone directly opposes the implant surface without any interposing collagen or fibroblastic matrix. The healing time for it varies, depending on the locality of the implant, whether it is in maxilla or mandible. Time duration in maxilla is for 6 months, whereas mandibular healing is for 3 months. The second figure shows placement of screw once the healing period is completed and this screw is left uncovered, which means it is not covered by the gingiva. It is then left for few weeks before the insertion of abutment into it, as shown in the third figure. It takes up till 3 weeks for maxilla and 1 week for mandible. The last figure shows when the abutment is inserted. An impression is taken to make the superstructure, for example crown, bridge or denture. Why an implant? They replace missing tooth roots and form a stable foundation for replacement teeth that look, feel and function like a natural teeth. Dental implants also help in preserving the remaining bone by providing the stimulation that was being provided previously by the natural tooth roots. Hence it prevents future bone loss. Bone that disappears when a tooth is removed can only be replaced by the bone graft. These implants also help in supporting crown, bridge and denture. It helps in improving aesthetic appearance of the patient and prevents the gum recession. Let's talk about the advantages of dental implants. One of the most important advantage to implant is that it maintains bone anatomy of the oral cavity, which means, if you have a missing teeth, the bone begins to shrink over time. Unhealthy bone loss could result the jaw line to recede, leading to change the facial structure of the patient, which therefore would cause the drifting and shifting of the other natural teeth. Dental implant helps in preventing the deterioration of the jawbone, therefore it helps in retaining the natural shape of the face. In many cases, a better long-term alternative to bridge work, these implants eliminate the need to grind down the healthy teeth when replacing one or more adjacent teeth. Patients' own natural healthy teeth are not compromised. Securely anchored dental implants do not slip or move. This eliminates some of the key problems of dentures, including poorly fitted dentures, gum irritation and pain from exposed nerves. The result is superior comfort, reliability and freedom from embarrassment. In other words, patients are happy and confident. On the other hand, if we talk about disadvantages of dental implant, implants are expensive, which means the financial investment is high. The second disadvantage is duration of the entire procedure. It's a time-taking treatment for the patient. It can take several months to complete. An implant may loosen and can also require replacement. Bruxism is a significant component of failed implants. These procedures may be emotionally challenging for the patients. Thank you for watching this video. For questions or queries, kindly write us in the comment section below. And don't forget to like, share and subscribe our channel for more interesting videos of dentistry.